Hi, this is Nikki. I am the nurse navigator for the Orthopedic Surgical Center Total Joint Replacement Program. Today, we are going to go over how to get ready for surgery, what happens when you are here surgery day, and what do the first 7 days of your recovery look like. We do have a surgery center website there in the center of the screen that has an abbreviated version of this information in the total joint tab, along with other general information about our surgical center. At the bottom at the bottom left, you can see all of my contact information should you or your family need to get in touch with me before or after surgery. To start, we are going to discuss getting ready for surgery. At this point, you should have seen or at least scheduled an appointment with your primary care physician that is going to clear you to have surgery. So they have to fill out a clearance form, do some lab work, and an EKG. Do not put this off until last minute, or we may have to postpone your surgery. If you use tobacco or nicotine products, please either decrease use or cut use completely several weeks before surgery. This will help improve your healing, especially at your surgery site after surgery. Some of you will be asked to fill out a patient survey where we ask you questions about your quality of life, activities you're able to complete now with your current joint, and then we'll ask you to do them 3 months post-op. If you are asked to complete these, please do so ASAP, as some of your insurances require this, and we don't want to have that outstanding for too long. Starting today, if you take any over-the-counter vitamins, over-the-counter herbal supplements, any kind of weight loss medication, any kind of energy supplementation, please stop that well in advance of surgery. You can see some examples there on the screen, but this is $1 billion industry and I couldn't possibly list all of them. So if it's something that's not a prescription, please go ahead and stop it well in advance. In your handbook, there is a list on preventing falls in the home after surgery. I highly suggest, while you have the luxury of time, that you get that list out, walk through the home with you and whoever your primary caregiver is going to be after surgery, and just think about if you're using a walker, if you're having to prop your leg up multiple times a day, is the house ready to do that? And if it's not, go ahead and get it ready to accommodate those things. Here is some equipment that you may need for surgery. Everyone will absolutely need the rolling walker and the calf compression device to help prevent blood clots. Total knee patients may also benefit from the commode frame on the bottom left, the cold wrap in the middle at the bottom, and everybody will also need the Hibiclens soap to use at least 2 times before surgery, which we will discuss in an upcoming slide. Many of you will be asked to participate in a pre-op PT session. And there are a couple of reasons there. You can see why that's important. Most importantly, they will be giving you your home exercise program that you will start about a day after surgery and continue for the first 7 days until you get started informal physical therapy if you're a total knee, or you'll just advance the exercises per the home exercise program if you are a total hip. So if that is not something that you are signed up for, please give me a call or an email and let me know so we can get that scheduled as soon as possible. 7 days before surgery, you need to stop the following medications in red. So you may need to make yourself a note or put a reminder in your phone that 1 week before surgery, you need to stop anything that has aspirin in it, anything that's considered an anti-inflammatory. These are used a lot for knee and hip pain before surgery. Anything that is an anticoagulant or blood thinner. Please note in green that Tylenol products are perfectly fine to take in this 7-day period as directed up until the night before surgery. Typically, we will send your prescriptions for surgery electronically to the pharmacy of your choice that is not a Walmart. Please pick those up and have those in home a day or 2 before your surgery date. When it comes to preventing infection, there are a lot of things that we do here at the surgical center. There are some things you can do before you even get here to help lower the risk of getting an infection in your surgery site. Should you experience any signs or symptoms of illness like fever, nausea, vomiting, diarrhea, cough, cold, COVID symptoms, UTI symptoms, please report that to me and then contact your primary care physician to see if we can get it resolved without having to move your surgery date. Monitor the skin on your legs, especially near your surgery site between now and surgery. We want to avoid things like cuts, scratches, bug bites, etc., so that we don't have an increased risk of infection. Do not shave legs 72 hours before your procedure, as this can increase the chance of broken skin, which could be problematic. Nothing combats infection like washing hands. So if you are not in a good hand washing habit, now is a good time to get in one. 24 hours before surgery, do not drink alcohol. You will take shower number 1 with that antiseptic soap that I showed you earlier. You are not to eat or drink anything after midnight the night before surgery. Before you go to bed the night before surgery, please take about 1,000 milligrams of Tylenol and place the prescription anti-nausea sticker behind either ear before you go to bed. Please note at the bottom, no kids are allowed in the surgery center and only one person is allowed to accompany you that day, just because we only have so much space in the building. Again, that soap that you are going to purchase needs to be used the night before surgery, the morning of surgery. Do not use this soap in sensitive areas like hair, face, genitals. So with either one of the showers, if you want to do those areas, do them first, rinse that soap or shampoo away, and then grab this soap. As you put this soap everywhere in the blue box, front and back, I do want you to let it sit for 3 minutes to make sure it gets as much of those germs that are normally on our skin off. So let it sit 3 to 5 minutes, rinse it away. Don't put anything else on your skin in or out of the shower after that. Dry off with a fresh, clean towel, sleep on fresh, clean pajamas, sleep on fresh, clean sheets. And the morning of surgery, you are going to repeat the exact same thing. Get everything in the blue box, front and back, covered with the soap. Let it sit 3 to 5 minutes. Dry off with a fresh, clean towel, put on fresh, clean clothes, and come to the surgery center. Morning of surgery, do not take any medications here listed in red. You really only need to take heart medicines, seizure medicines, and certain blood pressure medicines, like the ones that end in OLOL or INE. But we do not want you to take all of your normal home medications that morning. If you're not sure, if you want to run it by me, I am super happy to go over that list with you. Just give me a call or shoot me an email. The morning of surgery, do not wear any perfumes, colognes, lotions, powders. I do recommend that everybody wear a 2-piece outfit that is very comfortable and easy to move around in. Please remove nail polish, acrylics, anything thick from the fingernails and the toes of the surgical foot. You should leave all metal, all jewelry at home. If you are going to bring any contact lenses, glasses, hearing aids, etc. with you to help make it easier to communicate, please bring a nice sturdy case to put them in when you're in the OR. Also, please let your ride for the day know that they are not allowed to leave campus when you are here in our care. So they can't go grab breakfast, run some errands or anything. They have to stay on campus the entire time that you are with us. Surgery day expectations are next. So you will be given a surgery time, and the expectation is that you check in an hour and a half before your surgery time. And this allows us to do a lot of the things on the screen here. Please make sure you bring your driver's license, medical insurance card, and the forms from the large packet that you were given in the office filled out and ready to turn in. We do several things to get you prepped. We will have you do a full body wipe down with some body wipes that have that special soap in them. So you'll do a third body cleansing there. We will have you paint the inside of your nostrils with a special solution that helps kill staph in your nose. We will go over your medical, surgical history, daily medication use, make sure you stopped all of the correct medications, confirm allergies, etc. multiple times while you're here, and that's all for your safety. The anesthesiologist will come to you before surgery, answer any questions or concerns. The surgeon will do the same and mark your surgery site. We'll have you empty your bladder in the bathroom and then roll to the OR. For the bulk of our cases, we use general anesthesia. So patients go into the OR, we put medicine in your IV. You go all the way to sleep. We will intubate you at the time just to make sure your lungs are staying nice and expanded. When the procedure's over, we put medicine in your IV to reverse everything, take the tube out before you're aware, and monitor you as you continue to wake up. For our knee replacement patients, you will also likely receive some nerve blocks, though this will probably take place before surgery. We know that there are several nerves that carry a pain signal from the knee to the brain. And so we will inject some medication near those nerve highways to either slow that message or soften that message, and helps you get home safely with less pain and get you started on the oral medication regimen, so that you can just tolerate that a little bit better. Our surgeries can last anywhere from 1 to 2 hours, depending on the degree of arthritis that you have. While you're in the case, our surgeons will inject different kinds of pain medication, be it numbing agents, anti-inflammatories, etc., into the joint itself to help control pain from the inside out. We do not use catheters in bladders here at our surgery center, so you may or may not wake up initially with the disposable brief on. We will have you in all of your normal clothing before you leave. The recovery room length of stay is approximately 2 hours as well. Initially, it's just you and a bedside nurse one-on-one for about 45 minutes, checking vital signs, giving you pain medicine in your IV or by mouth should you need it, and checking circulation. They will usually give you some Sprite, some crackers, just to make sure you don't have any significant nausea. Then we'll move you to your post-op room where you'll have a stretcher for yourself, a recliner for your ride, and a table for the nurse as they take notes. And this is where we start sitting you up on the side of the bed, getting you dressed, walking you to the bathroom, taking your IV out, and giving you a refresher of your discharge instructions. These are the criteria for going home on surgery day. And again, it takes about 2 hours after surgery to complete all of them. If you need a little more time, obviously we will keep you until you're safe. But if you go through these pretty quickly, we're not going to keep you here any longer than you need to be. So let's talk about recovery at home. So this is basically the first 7 days at home. After that, you'll be allowed to advance activity as tolerated, though I certainly encourage you to do that slowly. You don't jump into your activities that you were doing before surgery, because you will get fatigued easily. Your leg will get very tired and achy easily. So ease back into those normal activities after week 1. But let's talk about the first 7 days. Activity is important after surgery. Being very specific in how we limit activity helps reduce swelling, reduce bleeding or bruising in the leg after surgery. So this is what I recommend during the daytime, every hour, approximately. I want you to take a short 5-minute walk. This is just to get your blood pumping, get your good joints moving. After that, I want you to use the calf compression device for 20 minutes. It'll automatically shut itself off after that. Then you can take 5 or 10 minutes to work on one of the stretches or exercises that the therapist gave you or that you can find in your handbook. And then you should spend the rest of the hour with your feet elevated off the floor, resting and icing the joint down. Again, after 7 days, you can start spending more time on your feet walking and less time with your feet propped up. But this is a very good rule of thumb the first 7 days after surgery. If you're having a knee replacement, this is one of the most important stretches that you should be doing after surgery for sure. So 2 to 3 times a day. You want to get somewhere where you can lay all the way down and get your feet propped up with a couple pillows, like in the picture here. You want those toes above nose, ideally. That lets gravity do its job the best. You'll notice behind this gentleman, there is nothing behind the knee as gravity is being allowed to pull the knee straight and get a nice hamstring stretch, which is essential after knee replacement. I do recommend, especially if you're having a knee replacement, maybe you've had arthritis for a while, this may be a good stretch to start now before surgery. So you're a little bit ahead of the curve after surgery. And of course, once you start physical therapy. Preventing blood clots is always a concern after any surgery, certainly after an orthopedic surgery. And here is how we combat those. Movement, we've already talked about that. Hourly walks, using calf compression devices, doing your exercises that the therapist give you. And then I want to add staying hydrated. As your blood chemistry changes after surgery, staying hydrated with water and juices seems to kind of offset those changes really well, in addition to these other things. The medication we typically prescribed, though it's very specific what your surgeon will want for you, we typically use baby aspirin twice a day for 30 to 35 days. Therapy after surgery is required for knee replacements at this time. It is not required for hip replacements. It should start approximately a week from your surgery date. We do want to make sure this is set up ahead of time. I would like to encourage you, if you are participating in formal outpatient physical therapy, please take pain medication about 30 minutes before the session, even if you're not hurting. And when you finish your session, go home, rest, ice, elevate to kind of stop the inflammation process, if you will. When it comes to bandaging, we have a lot of different options. For example, we have some stuff here for Dr. Broyles, and you can read the screen there. Here's for Dr. Hess. This is Doctors Pope and Murtagh. And of course, we will go over these instructions with you on surgery day. I just like to give you a little visual, a little heads up of what to expect, but they're very low maintenance. There's very little you're going to have to do in the way of wound care. It's mostly just monitoring, keeping everything clean and dry. Pain medication management. I think it's very important to give you a realistic expectation of pain after total joint replacement. I would say that you should expect to experience moderate but tolerable levels of pain. So what does that mean? Moderate. You are going to be very aware that you've had surgery. You are going to experience stiffness, soreness, tightness. Tolerable means that despite that, you should be able to walk and bear weight. You should be able to sleep, maybe not a full perfect 8 hours, but enough to recover. And you should be able to sit, maybe watching TV, playing on your phone without being completely distracted by excruciating pain. If none of those are able to be completed for you because of pain, please let us know. Most patients report the first 24 to 48 hours to be something of a honeymoon phase. You've gotten lots of medicines while you were here with us at the surgery center, and so they don't wear off as soon as you get home. And patients feel pretty good during this honeymoon phase. I emphasize at this point, please take pain medication anyway. Even if it's just Tylenol and the anti-inflammatory that we are going to prescribe to you, because we do know that honeymoon phase wears off, and we want some medicine in your system. Another thing to think about is not taking any pain medication is not ideal either. I know there's lots of opinions about medication, especially these strong pain medications, and they're all valid. I understand all of them, but you are having a big surgery and we need you moving pretty quickly afterwards. And so not treating pain or under treating pain will make it more difficult for you to walk and bear weight, sleep, sit and relax in your couch or your recliner. Remember, those things you should still be able to do. So if you can't do those, you might not be taking the medications appropriately. As we've talked about, I have charts for most of the physicians and I am super happy to share with you. If you like a visual reference, I can certainly share that with you to make sure you get into a good schedule, a good routine, and keep pain to that moderate level. Again, per that last bullet point, we recommend that you use non-narcotic pain medications, and this is usually scheduled around the clock doses of Tylenol and an NSAID. And then we will give you some stronger pain medicine to take in between those doses as needed if you had a really rough day, a really hard therapy session, or more most likely is before bedtime. That's when most patients take that medicine to help them sleep and get some good sleep. Constipation is a real concern, mostly because of the medications that we talked about, but Pretty much everything from anesthesia to not walking around as much, all of it can contribute. And I would much rather you be proactive than reactive. So you have some notes here on the screen. I recommend all total joint replacements start a stool softener like Senecot tablets or Miralax powder right after surgery. That evening or the next day, you can do it 2 times a day until bowel habits are back to normal. Of course, I've already mentioned it. We want you drinking plenty of fluids, waters, and juices, primarily. Dietary fiber with fruits, vegetables, and whole grains is always helpful. And those 5-minute walks every hour that we talked about for circulation help your belly just as much as it helps with your circulation and your good joints. So please make sure you are moving around. Dr. Hess's patients have the following precautions. This is just for Dr. Hess hip patients, and you will get a copy of this on surgery day. But we want you to avoid certain movements for about the first 6 weeks after surgery until your hip is healed up and nice and stable. So we don't want the surgical leg going out away from the body. That's what we call abduction there in the center. We don't want it going behind the body, back behind you. That's what we call hip extension. So my easiest way to remember this is to avoid out back, like the steakhouse. But again, you can see there's lots of pictures here. And again, this will go home with you on surgery day as a reminder. You are always welcome to call me or your doctor's office with any questions or concerns. We for sure want to know about the following things on the screen: a fall, even if you think you're okay; uncontrollable pain. So you've rested, you've iced, you've elevated, you've taken all the medications per the chart, and you are still experiencing severe pain for a prolonged time. That's very unusual. We need to know about that. Any change in the color, feeling, or temperature of an extremity, hands or feet, I would want to know about that pretty quick. Any kind of drainage of any color from the surgery site, I for sure need to know about. Excessive persistent swelling. Again, we've mentioned you're going to have some swelling. I've given you some tips to help keep it to a minimum. But if you're doing all of those tips and you notice that the swelling is not getting better throughout the day, maybe as you ice and elevate, please let us know so we don't have circulation issues. Increased redness around the incision could indicate a few things. Same with rash and blistering around the incision. If you experience those, you can take a picture. You can text it to the work cell phone number that I had at the front of the presentation and that's in the handbook. And let's see if that's something we can troubleshoot quickly. And then lastly, a persistent temperature. It's not unusual for some patients to run a low grade temp once or twice. But if you're running a significant temperature over about a 24-hour period, please let me know so we can get you in and get you checked out or do a further assessment on you. Some general activity restrictions are listed here. And of course, this is different for every patient, but I like to give you some general guidelines. When it comes to driving, you certainly can't drive if you are taking the strong narcotic pain medication. And if you are still using a walker because the leg doesn't feel strong enough or doesn't feel like it moves fast enough to walk, it's probably not strong or fast enough to use on the gas and brake pedals. Most people are driving, depending on the type of surgery and the side, 2 to 4 weeks after surgery. Long car trips and flying, so long distance travel, can increase your chance of a blood clot. I would like to have you postpone those if at all possible for the mentioned timelines on the screen. Dental cleanings and colonoscopies can increase your chance of a joint infection. So I would like you to also postpone those postoperatively for the times on the screen. You will have some follow-ups that are essential to help make sure we don't have any unexpected complications. Each doctor does this a little bit differently, but approximately this is the schedule here. We can always add appointments in between visits if we have an urgent issue. I always recommend you call me first. Let's see if we can troubleshoot something together. If we need to get you in, obviously we'll be happy to fit you in the schedule. But a lot of the stuff that patients experience, we just make a couple of behavioral adjustments or medication adjustments, and that usually fixes the problem. And that's it. If you have any questions or concerns about what you've seen today, please note on the very bottom in the center, there are my contacts. You've got my office number, my patient's cell phone number, only you guys have access to that, and my email. So if you have any questions, concerns about the information here in your booklet that you've been told, please reach out so we can make sure that you've got everything straight and that we are keeping you on the path to a successful outcome. I appreciate your time today. Bye.